2 hours ago, the White House crossed a line that has medical professionals, patient advocacy groups, and international health organizations calling this the most dangerous executive action in modern American healthcare history. President Trump signed an emergency order demanding that Canada transfer all patents and production licenses for insulin and 12 other critical medications to American pharmaceutical companies within 30 days. Not purchase agreements. Not licensing deals. Forced transfer of intellectual property that represents decades of Canadian medical research, under threat of complete pharmaceutical trade embargo. The executive order contains 3 components that fundamentally rewrite international patent law. First, all Canadian pharmaceutical patents deemed essential to American public health are subject to compulsory licensing under emergency health security provisions. The administration claims the right to determine which medications qualify and at what compensation rate. Second, Canadian companies producing these medications must establish manufacturing facilities on American soil within 90 days or lose all access to American markets. Third, any Canadian government action to protect these patents will be treated as a hostile act against American healthcare security, triggering immediate sanctions. The justification came through a hastily arranged briefing where the health secretary pointed to insulin prices that have tripled in the past decade. American families, he said, cannot afford medication that costs pennies to produce but sells for hundreds of dollars. The administration framed this as breaking the pharmaceutical monopoly and ensuring affordable healthcare for American patients. What they did not mention is that Canadian companies are not responsible for American insulin prices. American pharmaceutical companies are. And those same companies are the ones positioned to benefit from forced patent transfers. The White House expected moral pressure to work in their favor. How could Canada refuse to help diabetic American children access affordable insulin? They expected Carney to negotiate compensation terms that allowed him to claim he protected Canadian interests while ultimately giving American pharmaceutical giants exactly what they wanted. They were catastrophically wrong. Mark Carney appeared in Ottawa 75 minutes after the order went public. He stood at the podium flanked by the Canadian Health Minister and, notably, the Director General of the World Health Organization appearing via satellite from Geneva. The visual sent an immediate message. This was not a bilateral dispute. This was an attack on international health governance. Carney opened with a single sentence. Mr. President, you cannot patent someone's survival. Then he laid out what the executive order actually represents. Canada does not control American insulin prices. American pharmaceutical companies do. Those companies manufacture insulin in the United States using processes that have been available for decades. They choose to charge Americans exorbitant prices because the American system allows it. Canada's role is producing affordable generic alternatives and conducting research that has led to improved formulations. What Trump is demanding is not access to insulin. America already has that. What he is demanding is the right to seize Canadian intellectual property and hand it to the same companies that created the pricing crisis in the first place. Then came the countermeasures. 4 actions that revealed Canada had been preparing for exactly this scenario. First, Canada is suspending all pharmaceutical exports to the United States effective immediately. Insulin, cancer medications, generic antibiotics, antivirals, everything. Over 2,000 different medications that Americans depend on, gone. Carney was explicit. If the United States believes it can simply take Canadian medical research, then the United States can manage its healthcare needs without Canadian pharmaceutical supply chains. Second, Canada is filing emergency petitions with the World Health Organization, the World Intellectual Property Organization, and the International Court of Justice. But more significantly, Carney announced that the WHO Director General has agreed to convene an emergency session on pharmaceutical sovereignty and the weaponization of patent law. 40 nations have already signaled support for Canada's position. Third, Canada is forming a pharmaceutical research alliance with Switzerland, Germany, Sweden, and Japan. These nations represent the world's leading medical research capacity. The alliance will establish protected patent frameworks that prevent forced transfers and ensure that nations investing in medical research can benefit from their innovations. Carney revealed that preliminary agreements were signed weeks ago. Canada saw this coming. Fourth, Canada is immediately halting all medical isotope exports to the United States. This requires explanation because most Americans have no idea what medical isotopes are or why they matter. Medical isotopes are radioactive materials used in cancer diagnosis and treatment. They have extremely short half-lives, meaning they decay quickly and must be produced constantly. Canada produces over 60% of the world's medical isotopes. American hospitals depend on Canadian supply for tens of thousands of cancer scans every single week. Without Canadian isotopes, American cancer diagnosis effectively stops. The room went silent. Carney had just announced that Canadian medical exports were over. No insulin for diabetics. No isotopes for cancer patients. No generic medications for the millions of Americans who depend on affordable Canadian pharmaceuticals to survive. Then the WHO Director General spoke. She called the American executive order a violation of international health law and a dangerous precedent that threatens global medical cooperation. She announced that the WHO is suspending all collaborative research programs with American institutions pending resolution of this crisis. She reminded the world that weaponizing healthcare has consequences that extend far beyond bilateral disputes. Within 2 hours, the American healthcare system began showing cracks. Pharmacy chains issued alerts about impending shortages. Hospitals reported that cancer treatment schedules would need to be revised as isotope supplies ran out. Patient advocacy groups flooded congressional offices with desperate calls. The American Diabetes Association called the situation a manufactured crisis that will result in preventable deaths. The American Cancer Society warned that diagnostic delays caused by isotope shortages will lead to later-stage diagnoses and reduced survival rates. But the political firestorm came from an unexpected direction. American pharmaceutical companies, the supposed beneficiaries of Trump's order, issued statements ranging from cautious to openly critical. They understand what Trump apparently does not. Forced patent seizures destroy the entire framework of international pharmaceutical cooperation. If Canada's patents can be taken today, then American patents can be taken tomorrow by any nation claiming health emergency. China could seize American COVID vaccine patents. India could take American cancer drug formulations. The precedent Trump is setting threatens American pharmaceutical dominance far more than it helps it. Major hospital systems across the United States began projecting the impact. Without Canadian isotopes, cancer diagnosis capacity drops by 60% immediately. Without Canadian generic medications, drug costs for Americans increase by an estimated 40% as cheaper alternatives disappear. Without Canadian insulin, the 8 million Americans who depend on it face immediate supply crisis. These are not theoretical projections. These are operational realities that hospital administrators are calculating in real time. The international medical community reacted with alarm and solidarity. The European Medicines Agency expressed full support for Canada's position. The Swiss pharmaceutical industry warned that forced patent transfers would trigger immediate withdrawal from American markets. German research institutions announced suspension of collaborative projects with American counterparts. Japan's health ministry called the executive order incompatible with international medical cooperation frameworks. But what genuinely shocked Washington was the speed and coordination of Canada's response. The export suspension was implemented within hours. The WHO emergency session was already scheduled. The pharmaceutical alliance agreements were already drafted. Carney did not scramble to respond. He activated a plan that was clearly ready long before Trump signed anything. Here is what makes this crisis fundamentally different from trade disputes or resource conflicts. Healthcare is immediate and visceral. A diabetic patient who cannot access insulin is in medical crisis within days. A cancer patient whose diagnostic scan is delayed by isotope shortages faces reduced survival odds. Parents watching their children ration medication because Canadian generics are no longer available will not accept diplomatic explanations or lengthy negotiations. They will demand immediate action from their government. And the political math is devastating for Trump. 8 million American diabetics. Tens of millions more depend on Canadian generic medications. Hundreds of thousands of cancer patients require Canadian isotopes for diagnosis and treatment. These are not abstract statistics. These are voters in every congressional district, every swing state, every community across America. And they are about to experience a healthcare crisis that is entirely preventable and entirely Trump's fault. The American medical establishment is in open revolt. The American Medical Association called for immediate reversal of the executive order. The Association of American Medical Colleges warned that the WHO suspension will cripple American medical research. Hospital associations across the country are projecting operational chaos within weeks. These are not political opponents. These are the institutions that keep Americans alive. Congressional representatives from both parties are demanding emergency briefings. Senators from states with large diabetic populations are already backing away from supporting the order. House members are hearing from constituents who depend on Canadian medications and want to know how the government plans to keep them alive. This is not a foreign policy debate. This is a domestic healthcare catastrophe with a 30-day fuse. Trump now faces an impossible situation. Enforce the order and watch Americans die from preventable medication shortages while the entire international medical community isolates American research and pharmaceutical companies. Or rescind the order and admit that the most aggressive healthcare action in modern American history was a catastrophic miscalculation. Or attempt to negotiate with Carney from a position of complete moral and practical weakness while American patients suffer. But Carney made clear that negotiation has conditions. The executive order must be fully rescinded. American pharmaceutical companies must issue formal commitments not to pursue forced patent transfers. And the United States must support international frameworks protecting medical research from exactly this kind of weaponization. Only then will Canada consider restoring pharmaceutical exports. 2 hours ago, Trump thought he was solving American healthcare costs. 2 hours later, he created a healthcare crisis that will define his presidency. He wanted affordable insulin. He triggered insulin shortages. He wanted to break pharmaceutical monopolies. He united the entire pharmaceutical industry against his approach. He wanted to look strong on healthcare. He manufactured a crisis that will result in American deaths. And Mark Carney is not playing the game Trump expected. He is not defending pharmaceutical profits. He is defending the principle that medical research cannot be seized at gunpoint, that healthcare cannot be weaponized, and that nations investing in saving lives deserve to benefit from their work. The international medical community is watching. And they are siding with Canada. Every American who cannot access insulin this month, every cancer patient whose scan gets delayed, every family facing medication shortages will know exactly who to blame. And the answer is not Canada. Canada was willing to supply these medications. Canada has been supplying them for years. The answer is the president who decided that taking what America needs was easier than fixing the broken system that makes it unaffordable.